Hi, I'm Alisha from the Melanin Initiative Podcast. Our mission is twofold. One, to simplify complex health information so you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and entrepreneurs. In less than 2 years, we've grown to over 50,000 views and 1,000 downloads, with an international audience spanning the US, Canada, the UK, Australia, and more. Our engaged listeners are professionals, entrepreneurs aged 25 to 44 who value authentic, impactful content. Want to connect with this dynamic audience? Advertise with us. Send in your 1-minute video ad and let's amplify your brand. Email tmi.melanin@gmail.com for rates and details. Let's work together.
Hello, everyone, and welcome to the Melanin Initiative. Here at the Melanin Initiative, we simplify medical information into language that you can understand. We create a safe space for you to ask your questions and share our nursing perspective. Today's episode, we'll be talking about respiratory infections. If you're new here, once again, welcome to the Melanin Initiative. I'm Geraldine, and I co-host the Melanin Initiative along with Kimberly and Alisha. We're a health literacy podcast. When we say health literacy, we're talking about your ability to obtain information, to understand that information, and to use that information to manage your health and advocate for others. Our mission is twofold. First, we want to simplify complex health information so you feel empowered to ask your questions, educated on how to manage your health, and confident to navigate the healthcare system. And two, to elevate the expertise of nurses, spotlight the diverse career opportunities within the healthcare industry, and inform our peers how to leverage their expertise as clinicians and as entrepreneurs. If you haven't already, subscribe so you can be notified when we release a new episode. Thumbs up the video, leave a comment, and share our show with your friends. This shows the algorithm that the show is important, so that when people like you look for information like this, will show up higher in your search results. As a reminder, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you're experiencing a medical emergency, you can seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency, you can call 988 or text 741-741. All right, Kimberly, let's get started.
Today, we're going to dive into a topic that affects all of us, respiratory infections. These illnesses that impact the respiratory system include the nose, throat, lungs, and airways. Let's do one of my favorite things and start with the anatomy, Alisha.
Right, Kimberly. So the respiratory system is divided into two main parts. The upper respiratory system includes the nose and nasal cavity, the pharynx, and the larynx. And the lower respiratory system includes the trachea, bronchi, bronchioles, alveoli, and lungs. These areas are essential in helping us breathe. So when one part gets infected, it can have a significant impact. And we're going to have a picture display so you can see what these systems look like.
Yeah, so if you're listening on Apple or Spotify, we invite you to check us out on YouTube, Facebook, or LinkedIn so you can see our beautiful graphics. Shout out to Angie for helping us out with that. Let's talk about some common upper respiratory infections. One of the most common is, of course, the common cold. These symptoms are pretty well known: cough, runny nose, congestion, sneezing, and sometimes you might even experience a mild sore throat. It's usually caused by the rhinovirus, and transmission can happen through droplets, which can be transmitted through coughing or sneezing. And those droplets leave your mouth and they can land on surfaces. And when you touch those surfaces, it can then be transmitted that way when you bring that hand anywhere to an oral surface that can just enter the body, which is why we talk about hand hygiene all the time. Treatment that's so for this case, common cold, treatment's going to be mostly supportive to treat those symptoms that I mentioned. And so you'll see things like over-the-counter recommendations, rest, and hydration. Angie's going to throw up another graphic for me. This medication is called Quercetin.
Quercetin.
Oh, you all know it. So I didn't even know this existed till my brother told me about it. And you know,
Yeah.
this show was started after a gentleman couldn't explain to me what high blood pressure is or what it does to the body. So at the heart of this show is trying to increase awareness and understanding about high blood pressure. And so when we talk about common cold medications, a lot of them have medication, an active ingredient that can elevate your blood pressure. And so the last thing we want to do is tell you to treat one thing and make something else worse. So when he told me about this, I told everybody. So we're telling you, putting it up on the screen. Now, this brand has a bunch of other types of medications, like there's for other conditions, but we're talking about cold and flu. So I threw this one up there. I invite you to check it out. The link will be in the description box. And shout out to my little brother, Pierce, for educating his sister. And even my cousin, Nikki, knew all about it. And you too. So I'm the last to know, but maybe there's someone else listening or watching who also finds this information helpful for the first time. Okay, Geraldine, take it away.
All right. And another common infection that we typically see is sinusitis. This infection can be viral, bacterial, or allergic, and it causes symptoms like facial pain or pressure, nasal congestion, and thick nasal discharge. Usually these patients are pretty miserable because all of the symptoms are right in the center of their face. It can sometimes even cause headaches. For viral sinusitis, supportive treatment works the best. And when we say supportive, we're talking about rest, hydration, and over-the-counter medications. If the infection is bacterial, antibiotics might be necessary.
So next up is pharyngitis, which is the inflammation of the throat. So you might feel pain or scratchiness in the throat, and swallowing can become difficult. It's caused by both viral and bacterial infections like strep throat. We've all heard of that one. Again, if it's viral, we go to supportive care, but if it's bacterial, we're talking antibiotics.
When you look at the word biotic, right, it's part of bacteria. And as the girls have explained, viruses that cause the common cold are viral infections. And that's why taking an antibiotic won't help. In fact, it's only going to increase that risk of antibiotic resistance that we've talked about in the past. And so we just want to emphasize why we're recommending that. The other reason we put up the graphics is so you can see the anatomy, how that viruses and bacteria enter our body. And so just like when we talked about urinary tract infections before, you have things out in the environment. If we can prevent them from making it to your body, that's one first step in prevention. That's where hand hygiene is important, and wearing a mask can be super important too. And all of us, we're just going down that anatomy. It's starting in either the mouth or the nose. And if it continues to not get treated or progresses, maybe the treatment you're using is not working, it will just continue to make its way up and down. And so now we're down to the larynx. So now we're going to talk about laryngitis, which affects your voice box. This leads to hoarseness. You can lose your voice and also experience dry throat. This one usually is due to overuse of the voice, viral infections, and irritants. Once again, treatment's going to be supportive because there's not a bacteria involved.
Now, moving on to lower respiratory infections. So pneumonia is one of the more severe conditions as far as respiratory infections are concerned. It causes inflammation and fluid buildup in the air sacs of the lungs. Symptoms can include cough, fever, chest pain, shortness of breath, and fatigue. And pneumonia can be caused by bacteria, viruses, or fungi. And the treatment, of course, will depend on the type of pneumonia.
Another lower respiratory issue is bronchitis, which causes inflammation in the airways of the lungs. It's most often caused by viruses, with 85% to 95% of acute bronchitis cases in healthy adults being viral. Once again, that means no antibiotics. So symptoms include cough, chest pain, congestion, fever, and fatigue, as well as other viral infections. The treatment is usually supportive unless there's a bacterial cause. As you can see, a lot of these respiratory illnesses have the same signs and symptoms. So your provider will be running certain tests to see what kind of infection you have.
And while that on the surface might seem overwhelming, the good news is that the treatments is still the same. So even if you don't know which one it is, the treatment that we're going to recommend is still going to be an effective and safe one for you. The influenza or flu is another big one. We've all heard of the flu. It's highly contagious. It affects the nose, the throat, and if it doesn't get treated, it will make its way down to the lungs, as Geraldine just explained. Those symptoms, again, fever, chills, body aches, runny or stuffy nose, and fatigue. The treatment for flu is also going to be supportive, but if it's caught early, we can give you things like antiviral for viral infections, Tamiflu, most popular. I don't think you guys have heard the dog in a while, so he says you all. If you have those symptoms and you get treated within the first 48 hours, we can give you Tamiflu.
Great. And then another virus that we've heard recently out there is the respiratory syncytial virus. It's a very common virus. It's especially common in younger children and older adults. It can cause symptoms like coughing, fever, runny nose, and wheezing. In most cases, RSV doesn't cause severe illness in healthy adults or children, but for older adults and infants under 6 months, it can lead to serious complications that may require hospitalization.
So thanks for that, Geraldine. So that brings us to risk factors. Certain groups of people are at a higher risk of severe respiratory infections. For example, older adults, children, pregnant women, and anyone with a weakened immune system.
Absolutely, Alisha. And respiratory infections are more common in the fall and winter months. That's when we see higher number of cases, and although they can affect people year-round. Some of the reasons we see colds and flus in the winter are because of things like indoor gatherings during the holidays. People spend more time indoors, especially at home or at school. This puts us in close contact with one another, making it easier for those viruses to spread. The dry air, it can make our nasal passages more vulnerable to infection because we really need a warm, moist environment to keep things moving. And so when that's not present, things can sit, they can grow. The flu virus protects the lipid layer, hardens in the cold, dry environments, allowing it to survive longer on even surfaces. Mm-hmm. And then those people we talked about before who have that weakened immune system, cold temperatures slow down your immune system. And the nose plays a huge role when it comes to filtering out germs. But when it's cold, those cells attack viruses and they may not work as well.
Yeah, absolutely. I've already started seeing lots of flu cases in the clinic. So we're at that point now, unfortunately. But as far as diagnosis goes, it typically starts with a history of symptoms. So the provider will ask you about your symptoms, when they began, what type of symptoms you're having. Typically, a physical assessment is also done. And sometimes we can do point of care testing that may include tests like flu tests or strep tests. Some providers may also have RSV testing in their clinics. So those are tests that we can typically do, and it's usually rapid. Within minutes, you find out your results. Treatment depends on the cause of the infection, of course. Viral infections, once again, don't require antibiotics, usually supportive treatment, potentially Tamiflu if it is influenza A or B and started within 48 hours. But once again, just rest and hydration for the most part. Bacterial infections, on the other hand, like pneumonia or strep throat, they do require antibiotics.
All right, so now let's talk prevention, which we love to talk about here on the Melanin Initiative. So hand washing is one of the best ways to stop the spread of respiratory infections. You can also use a gel-based sanitizer. Avoiding close contact with sick individuals, staying hydrated, and of course, getting vaccinated are all key in preventing infections. The annual flu vaccine is especially important. We recommend getting it between September and March, in that fall, winter phase of the season. So the flu vaccine is available in several forms, including an inactivated flu vaccine, which is a standard dose vaccine approved for people as young as 6 months old. There's a recumbent flu vaccine, which is the typical one that we're used to, which is approved for people 18 years or older. We have the adjuvanted and high dose inactivated vaccines, which are approved for people 65 years and older. We have jet injector, which is a high pressure stream of fluid that goes through the skin instead of a needle. And then we have a nasal spray, which is approved for people between 2 and 49 years old.
And for my plant-based friends out there, if you don't consume animal products, you can ask for the egg-free version. You might have to call in advance and they might have to order it, but it is available, but you do have to ask for it. We love to address vulnerable populations here at the Melanin Initiative. And so there are some things we want to consider when we talk about respiratory infections for them. These populations are more likely to experience severe illness or longer recovery times. And so it's important that we understand their unique needs.
So let's start with children, especially those under 5. Their immune systems are still developing, so they're at a higher risk for complications like pneumonia or bronchitis. They may also have trouble expressing their symptoms, so it's important for caregivers to watch for signs like fatigue, trouble breathing, or a decrease in appetite.
Very important. So also older adults, especially those that are over the age of 65, are another vulnerable group. Their immune systems aren't as strong, which makes them more susceptible to infections like pneumonia or RSV. Many older adults also have chronic conditions such as heart disease or diabetes, which can make it harder for them to fight off these infections. The CDC recommends several vaccines for older adults, including the annual flu vaccine, specifically the annual high-dose or adjuvanted vaccine for 65 years and older, the pneumococcal vaccine also for adults 65 and older to protect against infections, the shingles vaccine for healthy adults 50 and older, which is given in 2 doses, the Tdap vaccine, which is a one-time Tdap if they've never received a Tdap vaccine, but then it's typically given every 10 years as well, a booster. And then the RSV vaccine is for adults 60 and up, or especially for those with heart or lung conditions after consultation with a healthcare provider.
And we want to address a few things that we see very commonly in our practice. So one thing, vaccines. They expose your body to the virus so that your body can build up a response, so that the next time your response will be either not at all or lessened. So I know some people say, oh, I got the flu shot and then I got sick, or I got the flu shot and I still got sick. What's the point? So the point is that, we're hoping that it decreased the severity of your disease. It shortened the amount of days that you had symptoms. That's the first thought. And what happens is sometimes it's just timing. You might have already had the virus in your body but no symptoms. You got your vaccine and then the symptoms became known. But it's not that the vaccine caused the symptoms. It's just a matter of timing. And we know there's many of you who are 50, 60, 70 years old who never took one. You're never going to take one. And that's okay too. We understand no one's here to pressure you. We're just here to provide information so you can be informed about your risk and what the options are. Again, we talk about vulnerable populations. Veterans are also at higher risk. Many of them are exposed to environmental hazards during their service, and this increases their likelihood of respiratory problems. Conditions like asthma or COPD can also make them more vulnerable to respiratory infections.
The LGBTQIA+ community should also be considered. This group faces unique health challenges, including health disparities that can make respiratory infections more severe. Additionally, some individuals may have compromised immune systems, and healthcare access is a barrier for some.
Sensory deficits like those experienced by individuals who are blind or deaf can create challenges in recognizing symptoms of respiratory infections. For example, those who are deaf might not hear a persistent cough or wheezing, which may delay their medical intervention.
And I just want to add, when we talk about the LGBTQ+ community, it's not that identifying with that population makes them more susceptible. It's their interaction with us in the healthcare system. If when they call or visit the website or come to the clinic and they don't get the respect that they deserve, if they're not protected in terms of their identity, how they want to be addressed, how the information is being shared with the other people in hearing sight, then it makes them less likely to come on to see us. The data shows that. And so a lot of times they wait till their symptoms are really severe, but by the time they come and see us, so then we report things like, oh, they're at more risk, but it's not because there's something wrong with them. It's just there's better things we can do to make healthcare more inclusive. And then let's not forget our individuals on the autism spectrum. They might have trouble communicating their symptoms, or they might be more sensitive to certain treatments. So it's important that we consider their unique needs. And if we don't know them, there's certainly a plethora of resources out here. We can utilize those and then provide the care that they need and make sure that it's as accommodating as possible.
So to reiterate what Kimberly previously stated, improving accessibility to healthcare for these vulnerable populations is essential. We need to make sure that people can access care when they need it, whether it's through in-person visits, telemedicine, or home care options.
Definitely. Making sure healthcare is accessible to everyone helps prevent delays in diagnosis and treatment. We also need to ensure that information is presented in a way that's understandable to all patients, regardless of their background or abilities. This includes gender identity, sexual identity, language is a really big one. And of course, for older adults, we want to make sure they can hear us. That's a really big one that we sometimes take for granted.
Yeah, exactly. And whether it's through public health campaigns, better healthcare access, or simply being more aware of the needs of vulnerable populations, we can work together to reduce the impact of respiratory infections.
And look, we hear you, our clinician friends. We know time is always an issue. So when you see those patients are on the schedule, or you know they're going to go schedule after they see you, say, hey, look, because of your unique needs, I want to make sure I give you the special TMI, right? And so either book them at the end of the day or the beginning of the day or a certain day of the week where you can really give them the time they need so they don't have to be rushed out. So for our TMI takeaways for today, remember, prevention is key. Vaccines play a crucial role in preventing respiratory infections like the flu, pneumonia, RSV, especially in older adults. And that prevention also includes washing your hands. And for our vulnerable populations, our older adults, those with chronic conditions, and immunocompromised individuals are going to be at greatest risk for severe complications from respiratory infections. And creating inclusive environments will also decrease those barriers. And that's from your website to your people who answer your phone. Geraldine might be in the back office and never know that some of her patients were treated inappropriately because they're never going to make it that far. So when you do your training, it has to include everyone in the office. And look at your documents too. Sometimes those can be reworded just so people feel like they belong. And then early intervention, identifying symptoms early and seeking medical advice can help manage and avoid experiencing more serious complications. Remember, everyone, you can email us your questions and show ideas to tmi.melanin@gmail.com. If you haven't already, this is your chance to subscribe. Leave us a comment or two, give us a thumbs up, share it with your friends. It shows that the algorithm that this information is important so that when people like you look for information like this, we'll show up higher in the search results. At the time of this filming, we release videos every week on Sundays at noon Eastern on YouTube, Facebook, LinkedIn. And the audio drops at 5 a.m. so that our night shift friends can be the first to get something and not the last. And maybe one day someone will play it during Huddle and tell us about it. We thank you all for watching. We'll see you next time.